Hello, I'm Claire Perks. I'm one of the GPs at Pembroke Road Surgery. Some of you may know that normally every 6 months I run a poorly Poppets session where I talk to new parents about what to expect in terms of illnesses in their new babies. A global pandemic wasn't on our radars, and in the context of that I thought it might be a good time to touch base with you and talk a little bit about what's going on and how we can prepare for the winter, albeit through this little video. So I'm going to talk a bit about coronavirus and how it's affecting children or not, and then I'm going to talk about what we should do if our children have a fever or a cough, and how we can keep an eye on them and when to worry, that sort of thing. So, coronavirus in children. It's obviously been an incredibly stressful time, very difficult for many reasons, but I think one of the reassuring things so far has been that there seems to be little cause for alarm about the effect this will have on our children's physical health, at least, and that we're not really seeing it affecting children in a dramatic way. A colleague of mine who works at the Children's Hospital tells me that since they started doing tests right at the beginning of the pandemic, so months ago, and they do these tests on every child presenting in emergency department, every inpatient, every person coming in for outpatients, everybody's been tested. And so far at the Bristol Children's Hospital, they've had less than 10 positive tests. So the rates in children in Bristol at the moment are low, and let's try and keep it that way. Just because they're low, it doesn't mean that we must relax. It's so important that we continue to isolate and test and manage our children as if they may have it. We still don't know how this pandemic is going to roll out, and we need to do everything we can to keep nurseries open, schools open, and our community well. We still don't fully understand the role that children have in this pandemic. So what does the evidence say about how children are being affected? The Royal College of Paediatrics and Child Health have an excellent resource which summarises the data so far, a lot of which is from Italy, but increasing data coming from all over the world, and it was last reviewed on the 1st of September. I'm not going to go through all of it, but some of the headline news. So one of the things to say is that children have been shown to be less susceptible to catching coronavirus. There is asymptomatic carriage, but even the asymptomatic cases are less and children are picking it up less. It's believed that that's because they have a physiological difference from adults. It's understood that the virus is entering the body through the ACE receptors, which are all over the body, but particularly in the lungs. And in children, they are less expressed in the lungs than they are in adults. So they are less able to, I suppose, absorb the virus. Lots of data is showing that children are carrying it less, but also less symptomatic. A lot of the evidence has come from households where there is a known case of coronavirus and how that is spreading within a household. So that's reassuring. They've also looked at the children who have caught it, and as I said, the data is showing that children are either asymptomatic or very mildly symptomatic. There are a handful of cases in each country where children have ended up being unwell with it, needing hospitalisation and ending up on intensive care for supportive treatment. These children, 3/4 have had significant comorbidities, so other complex medical problems such as having tracheostomies, having rare genetic abnormalities. So we're not talking about children with one well-controlled other medical condition such as asthma or diabetes or whatever it may be. These are unwell children, and actually the death rate from coronavirus or with an association with coronavirus in children has been shown to be 0.01 to 0.1%, which is the same as the death rate in children from influenza every year. And actually, when you think about the children who sadly pass away with influenza, it's a similar type of child who is already very unwell and susceptible. And families who have children with conditions like this will be in touch with their specialists and doing everything they can to protect their children from catching it. But I think generally for the majority of children, the data is all very reassuring. So, given that our children will either not get it or be very mildly symptomatic, how are we going to know if our children have it? How are we going to be able to distinguish it from all those other illnesses that our children tend to get over the winter months? This brings me on to my next question. I just want to interject here with some data from the coronavirus tracking app where people were putting in daily symptoms. It showed that in the children who had positive tests, in 50% of occurrences, the adults and their families had no symptoms in the preceding week. They've also documented the common top 5 symptoms, which both adults and children are displaying, and you can see these here, fatigue being very prominent. Right, back to the video. So, how are you going to distinguish between whether your child has coronavirus or a cold? You're not going to be able to, and nor are we. So it's going to be difficult, and that's why it's so important that we all get our children tested. If your child has a fever, so a temperature of more than 37.8, or a continuous cough, and we'll come back to the coughing in a bit, but a new ongoing cough, then you should get them tested, and the whole family should go into isolation until you've all been tested. You book the appointment through NHS 111, the PHE website. In fact, if you just Google book a coronavirus test, it comes up. It'll ask you who has got symptoms and what their symptoms are, and then it'll ask for other members of the family who you'd like to have tested, and then it'll offer you appointments for your tests. And you can either drive to the airport, it's very easy. You go beyond the main entrance to the airport to the silver parking entrance, which is the one after the roundabout, and it's all very well signed, and you wear your face mask, and then they give you the swabs through the window. You swab yourself and your children, you pop a swab into your mouth and tickle your tonsils, and then you pop it up your nose. It makes your eyes water a bit, and then you package it all up and pop it in a bin, in a basket, ready to be sent off, and ideally get the results within 24 hours. I think it's a little bit variable at the moment. There's a walk-in testing centre by the Victoria Rooms in Clifton. If you've got young children and a car, and it's easy for you to get to the airport, it's probably actually easier because everyone's strapped in and contained, and you're not going to be exposing yourself to others. So the only way to know whether it's coronavirus or not is to do the test, which is our moral obligation. But also, if your child is in school or nursery, you just can't send them in with a fever and a cough without being able to say, I've tested, we're all negative, which will hopefully be the result. And if it's not, then you've absolutely done the right thing because you've stopped yourselves spreading it throughout the community. So this is why it's important just to think about the normal coughs and colds that our children are going to get. And this is where I normally do a bit of expectation management about the fact that children will generally get about 8 what we call upper respiratory tract infections a year. So what's an upper respiratory tract infection, I hear you say? So upper respiratory tract infections, or sometimes abbreviated to URTIs in the medical notes, are what you and I might think of as a cold, but actually it can make people quite unwell when you're only little and you've only got small airways. So upper respiratory tract infections are caused by viruses. There are thousands of different viruses that cause them, particularly in the winters, and we tend to see the adenoviruses, various different coronaviruses, rhinoviruses, and they infiltrate the upper airways, so the nose, the throat, the upper airways, the upper respiratory tract, the upper airways. Often the ears are infected and possibly the eyes. And I'm sure you can all picture the sort of slightly streaming eyes, snotty nose, productive cough, little toddlers. They also often, but not always, cause fever. And some children will get lots of different colds, which will cause very little in the way of upset, and they'll carry on eating and drinking and be fine. And other children, every time they catch one of these, their body will respond vigorously with fever, feeling generally sore and unwell, and it can often mean days off nursery. Just because one child responds differently to the next child, it doesn't mean that they've got a weak or a strong immune system. It's just that we are all different. And research shows that the average preschool child will get 8 to 12 of these a month. So if you think of your friends' children whose toddlers always have snotty noses throughout the year, it's because you stop noticing after a while, because it's one thing after the other. The cough tends to last about 2 or 3 weeks, but the sort of ill, feverish phase usually lasts 3 to 5 days. And it's managing, sort of helping you through that phase that I'm hoping to do now. It's unusual for babies under the age of 3 months to get a fever. So if you have a baby who is a little baby under 3 months and they have a fever, please do contact us straight away and let us know. Because they don't tend to mount the same response, because they've still got the placental antibodies, so the antibodies that the mother created and came to the baby through the placenta. The baby's job in their first few years is growing, and part of that is growing their immune system. And as their maternal antibodies wear off, they need to develop their own antibodies, and that's part of growing up, and part of our job as parenting is looking after our babies when they're poorly. But it can be very alarming, and children with a fever look dreadfully ill and really quite sort of deathly often, which is why it's important to treat a fever so that we can see how they are once the fever's come down. So how will I know if my child has got a fever? A fever is a raised body temperature above 37.8 degrees Celsius. It's actually really helpful to have a thermometer at home these days, because you then know where you're at and whether you need to get tested and isolate until you get the results back, or whether they're safe to go and be amongst friends and family or in school or whatever. So invest in an ear thermometer or an under-the-arm thermometer for the under 3-month-olds. Generally, children, when they have a fever, they feel hot to touch, particularly if you use the back of your hand on their forehead and on their chest. Pay less attention to their hands and feet. They often look very flushed. They might be breathing quite quickly, like a hot sort of panting dog. They might be really clingy and miserable and whiny, or they might just be a bit quiet and sad and pathetic. And if you see any of those signs, then I'm sure you're all aware now to measure their temperature. So you've decided that your child has a temperature. It's 38.4, and they're looking a little bit kind of disinterested and a bit hot and bothered and a bit sad. What are you going to do about it? So there used to be sort of old-fashioned, let the fever burn its course type of theories, but actually I think it's really important to treat a fever for 2 reasons. Firstly, so that they feel better and that they regain their sparkle a little bit, and that they feel well enough to drink, and so they're not getting dehydrated. But also it's really important then to see how they are once their fever's down. The fever itself will make a child feel and look ill. If once their temperature's back down to normal, they're still looking really ill, then that's when I'd be getting a bit more worried that there's something more sort of serious needing a bit more attention going on. So you've decided that they've got a temperature and you want to treat it. What are you going to use? The first line that we would always recommend is liquid paracetamol. So you can go to the supermarket or to the chemist and buy the age-appropriate dose. The leading brand that you've probably all heard of is Calpol, and it comes with a syringe use the amount that it says on the bottle for your age group, and when you're squirting it into your little one, make sure you're aiming at the cheek to the side rather than straight back, because that might just make them gag and vomit it all back all over you. So you've given them some paracetamol. I would then make sure that they're wearing the right clothes. So if they're all bundled up in lots of woolly jumpers, just strip them down to light clothing. Don't tepid sponge them. It will actually just make things a little bit worse and shut down their superficial capillaries and stop them from allowing their skin to cool down. And then I would always, with any child with a fever, strip them off and have a good look at them, and just have a look at their breathing, have a look to check they haven't got a rash, and then I would give them some milk or some water and just sort of cuddle them, read a story, watch telly, and leave them to sort of settle down a bit. And I would generally expect the paracetamol to start working within about 30 to 60 minutes. And they're not going to be on top form after that, but I would expect, once the temperature's coming down, for them to be a little bit more interested in what's going on, to be a bit more interactive with you. I'd expect their fast breathing to settle down, and you might be aware of their heart beating away, and I would expect that to settle down. Those are all natural body responses to a temperature. Sometimes the temperature doesn't actually settle that nicely. And if it sort of goes down a bit and they pick up a bit, but they just within an hour are hot and not well again, or in fact they did quite well with it, but you've got to 3 hours now and you're not allowed any more paracetamol till 4 hours, then the next thing we would add in is some ibuprofen. So ibuprofen is another medicine that we call an antipyretic. It brings down the temperature. Both paracetamol and ibuprofen also act as painkillers, so they're good if you're feeling a bit headachy or earachy or sore throaty, which your child might well be doing but not unable to tell you. And ibuprofen is an anti-inflammatory, so it's really good for when there's inflammation of the throat or the ears. Now, you may have heard in the media, social media, about concerns about ibuprofen and coronavirus. These were early concerns related to one specific case, and there's been a lot of research and expert analysis of what we should be advising patients, and the official guidance from the Royal College of Children and Paediatrics and Child Health and through NICE is that if children are already on regular ibuprofen for whatever reason, then that's fine to continue it. It should still be used for managing fevers. We would still recommend paracetamol as first line. It's fine to give ibuprofen if needed, but thinking also a little bit, which we would always do, if your child is a bit dehydrated, then we should be a bit careful about ibuprofen and steer clear of it. But also, it's important to manage fever, but if you're giving high doses of paracetamol and ibuprofen repetitively and they're not getting better, I suppose the message is to say don't just sit at home going round in circles. Do let somebody know, and we'll come to that. It's actually quite common to need both. And the beauty of having two different agents is that both of them are doses that you give. You can give every 4 to 6 hours, but you mustn't give them more than 4 times in 24 hours. And it's really important, particularly for paracetamol, not to exceed the limit, because it doesn't take giving a little bit too much, a little bit too often, to overdo it. So if you've got an unwell child who's needing regular doses, write down what you're doing, communicate if you've got a helpful other half at home who's also giving doses. And make sure you don't wake up in the middle of the night thinking, gosh, what did I give them last? And then you can give paracetamol, and then maybe 3 hours later some ibuprofen, and then 3 hours later some paracetamol, ibuprofen. So sometimes it's helpful to give them some paracetamol before they go to bed if they've got a sort of snotty, coughy, feverish illness. And then if they wake up in the night, you can give them a dose of ibuprofen if they need it. So what else are you going to be checking for? I talked about the fact that you'll want to strip them off and look for a rash. Lots of viral infections cause widespread rashes. The two common ones that we see, which are completely harmless but can be dramatic, are firstly just lots of little pinpricks all over the body that when you press them like this, they disappear. And they are very harmless, and they tend to go within about 3 to 5 days. Some children get almost an allergic reaction to the virus, and that causes something called a viral urticaria, and it causes these big sort of red wheals with sometimes raised white bits in the middle that look a little bit like nettle rash. Again, it looks very dramatic, but it's harmless and they'll settle. The rash that I'm sure you're aware of that we worry about is the rash of meningococcal septicemia. Don't be just reassured by the lack of rash. Meningococcal septicemia causes the child to be very ill. They wouldn't be getting better after their paracetamol and ibuprofen doses. They might start vomiting. They might be incredibly irritable, more than you've ever seen them, and inconsolable, or they might be very lethargic and unarousable. They might have very pale, mottled skin centrally in their trunk. And if you ever are worried about that, seriously worried, then call 999. Children rarely get suddenly very ill, which is why I think it's important for us to talk about the things that you can be doing to check on them. So back to rashes, the rash of meningococcal septicemia, it looks like a sort of deep purpley, reddy, sort of under the skin, almost like a sort of deep bruise, but they can be quite small. And when you press on them like this, and you sort of blanch the skin, they don't disappear. And you've probably heard of the glass test. That's just the same as pressing your skin down. There's a great video about picking up sepsis and recognising sepsis in children, which I have posted the link to next to the link for this video. And I would really recommend, when you've recovered from watching me for so long, that you have a look at that video, because it gives great examples of looking at poorly children with breathing problems, that sort of thing. And that's all the sort of stuff that's relevant to these children that we'll be managing with temperatures. But I've been a bit dramatic, and the majority of children will look rather awful. You'll give them some ibuprofen or paracetamol and they'll pick up a bit, and then they'll wake again, and you'll go through the cycle probably for about 3 to 5 days. They may well have a really good going cough, and that's because they're producing lots of mucus. The cough is a protective reflex that helps us to keep all that mucus off our chests, and so, but sometimes it goes into overdrive and they cough and cough and cough, often until they go bright red in the face and vomit. But if they're if they are little, then if you think about all that mucus that's up in their upper airways, sometimes just having a little bit of snot can make it really hard for them to breathe, particularly as babies under 6 months do most of their breathing through their noses rather than their mouths. So pop to the chemist and get some salt water drops, some nasal saline drops that come in a little squeezer, and you pop them into the nostrils, and that will help them clear the way with their breathing. So you've strip them off, you've given them some paracetamol, you may well give them ibuprofen as well. You're going to keep offering them fluids. How will you know if they're getting dehydrated? Well, the main way of telling is through their nappies. So children, babies in nappies, you'd expect them to have 2 really good wet nappies every 24 hours. Now the reality is that most of us don't leave our babies' nappies until they're really saturated, and you're changing them more frequently than that, but you're probably quite used to how your baby's nappies feel. They may well be a little drier than normal, their kidneys are reserving as much fluid as they can, but I would still expect them to be having 2 good wees every 24 hours, which you should be changing their nappies really every 6 hours and seeing that they are weeing. If they're getting dehydrated, they'll start becoming floppy and disinterested. They won't be engaging with you. If they are at that point, despite their fever coming down and they've got a temperature of less than 38 degrees, then do call for help. So I'm going to move on now to talking about how you can assess their chest and their breathing, because we know that cough is something that coronavirus can cause, and most children's viruses cause cough. And then we'll talk a bit about the end about how you can get help. The cough itself isn't actually a worry. It's really what it signifies that we need to be looking for. Now, the majority of causes of coughs in children are because of all the mucus from upper respiratory tract infections, which we've talked about. But sometimes the cough is because of something that's affecting the actual lungs, and that may well affect their breathing, and so it's important that we know how to assess how their breathing is doing. So in terms of what might be causing it, coronavirus might be causing a cough, and the the cough that coronavirus is causing tends to be a persistent dry cough rather than this sort of rattly, rackety smokers type cough that you see in children who are very snotty. And if they have a cough, even if they've had a snotty nose and they're not feverish, but they have got a new ongoing cough, we should get them tested, even if it doesn't sound like the typical dry cough. 3% of children with coronavirus had a productive cough, so it is small numbers. So other reasons for coughing other than upper respiratory tract infections and coronavirus, you may well have heard of bronchiolitis. That's an upper respiratory tract infection caused by a specific virus called the RSV. We see it also affects the lungs and can make breathing a little bit difficult. And some little children get a little bit compromised by that, and that's what we're going to be talking about now in terms of assessing the breathing. Some viruses affect the lungs as well themselves. They can make children a little bit wheezy and make the little tubes in the lungs a bit tight, which might affect the breathing. And if your child was going to go on and develop a pneumonia, which is unusual, but we do see it, then again, a bit like we were discussing before, they would be ill. So their sort of fast heart rate and their fast breathing and their listlessness would continue despite not having a temperature, like once their temperature's down, and they would be having problems with their breathing. So how are you going to tell if your child's having problems with their breathing? One of the most sensitive markers in little children who are still bottle and breastfeeding is how their feeding is going, because it's very difficult to feed well and breathe well. And so normally a child who could down a bottle in 15 minutes or a breast, you might find that they're having to do a lot of sort of and they're having to sort of frequently come off to catch their breath. As long as they're managing about half of their normal feeds, then that's reassuring that they're going to cope, which I think sounds a bit dramatic, but actually those are the recommendations from the Children's Hospital, and I think that's about right in terms of if they're strong enough to take half of their feeds, that'll do them in terms of hydration. And all of these bronchiolitis, upper respiratory tract infections, coronaviruses, they'll all get better by themselves. Pneumonia won't, and if they continue to get worse, then that's when we would be seeing them and possibly sending them into the Children's Hospital. But again, they would be getting worse and worse with their breathing. They wouldn't be feeding. They'd be working hard at their breathing. So how can we tell if a child is working hard at their breathing? A worrying sign in a child, which we sometimes see in little children with severe bronchiolitis, is something called grunting, where they're trying as hard as they can to keep their lungs open for as long as they can. And it's not just the occasional funny grunt, because children make all sorts of funny noises. It's a persistent grunt, which I'm going to do an impression of now, which sort of goes a bit like this. If your child's doing that, then do seek medical help straight away. But again, they won't just suddenly start doing that. Their feeding will be going down, they'll be becoming less interested in life going on, and they'll be working hard at their breathing. So again, take off their top, have a look at chubby babies, you can't see much in their neck, but as they get bigger, they develop a bit of a neck, and you might see them pulling in just here and here above their collarbones. If they're really having to work hard and you can see everything being sucked in, then that's a sign that they're working hard. And you can see the skin in between their ribs pulling in. You might see their tummy coming out, sort of below their diaphragm. And all of those things, if they are persistently looking like they're working hard at their breathing, get them checked out. Looking after a poorly child is always worrying, and that's part of our sort of Darwinian parental response, is to feel anxious about them, and it's really very hard, but you do get better at it as you get used to their particular responses and what their normal reaction is to these viral illnesses. If they've got a feverish illness and you've been giving them paracetamol and ibuprofen, fluids, and you've been keeping an eye on them, and either they're not sort of looking a bit better intermittently, or they're getting worse and worse, or they're not getting better after 3 to 5 days, they've got breathing problems, or there's just something that you can't put your finger on that you're really worried about, then do contact your GP. We've been working really hard throughout the pandemic. We've all been in at the surgery answering telephone calls. And so give us a call at Pembroke Road. You'll speak to one of our patient coordinators who will ask the duty team to give you a call back. And if you tell them that you're really worried, then we will get back to you as soon as we possibly can. We'll start off by just speaking with you, and if we're concerned, then we'll arrange a video conference where we'll send you a text message with a link, and then we'll be able to look at your child over video. If that doesn't help us enough and we feel like we need to see them, even if they've got symptoms consistent with COVID, then we will see them, and we will get into our PPE. We've got all the precautions, we're fully equipped, and we've been seeing patients throughout this pandemic with all the correct PPE and cleaning procedures. So don't feel that we're not here. We really very much are. But we also don't want to hear about every single cough and fever, because we will grind to a halt, and we've got lots of patients to look after through this, with all sorts of COVID and non-COVID things going on. So do have a go at managing them yourselves with some paracetamol and fluids, but call us if you're running into problems. If we are concerned about your child, then we will decide whether we want to send them into the Children's Hospital. We're incredibly lucky to have the Children's Hospital round the corner from us. They are very much a tertiary referral centre. They're there for us to refer into once we've spoken with them. Patients shouldn't just be pitching up on their doorstep. If you are really worried and you really think you've got a life and death emergency on your hands, then yes, they are there. But do try to come via us, and we will decide whether we need to involve them. They will totally grind to a halt if everybody goes straight to them, particularly in terms of infection control. It's really important that you speak to us first. If it's out of hours, so after 6:30 in the evening and before 8 o'clock in the morning, there are loads of GPs working out of hours, and you can contact them via 111. And the first port of call is 111 online, and then they will triage you as to whether you get a 111 phone call, and then they will decide whether you need to speak with a GP, and a bit like us, they will video you if they want to be able to see your child, and if they're concerned, they'll get you to come down to wherever they're working from. So there is a lot of support out there. If you're concerned that your child is in a life-threatening emergency, call 999. There are loads of resources out there in terms of trying to help decide when to worry. I think it's very hard to write a list of, if they're doing X, Y, and Z, worry. If they're A, B, and C, you're fine, which is why I've tried to explain this over a video to give a little bit more depth to it rather than a list. But the resources which are really useful, I have put on the Pembroke Road website. If you go to our services and to the baby clinic page, I'll put a link to it next to the link to this video. I've put all sorts of helpful resources for parents on there, but I particularly like the patient.co.uk resources. So if you type in fever or cough into patient.co.uk, they've got very sensible advice. There's a local resource called Cough Bristol, just Google Cough Bristol, which is evidence-based, developed by the Bristol University, based on lots of qualitative research with parents and doctors, that gives some advice on assessing and managing children with coughs. And those are the top two. I can't think. I'll put the rest on the website. Thank you very much for watching this. Well done if you've made it all the way to the end. I hope it's been helpful. Hopefully one day I'll be able to do my real live Poppets, where we have tea and cake together in the church hall, and you can ask questions. Stay well. Good luck. I know that managing fevers is just one small side of coronavirus. All the best with the holistic staying well and calm within your family. All the best. Bye.